Hey everybody, I wanted to welcome you all to the monthly child care call. I know we are right at 12:01. I'm seeing that Tanya, our director, she is in a call right now. She's actually apologizing that she is running late, but she has just advised me that she will be joining us soon. But we're going to go ahead and let Brenda Burr from our background check go ahead and start first. Brenda, I know you've got some updates to our background checks. Would you mind go ahead and sharing?
I will share. Good afternoon, everybody. So glad that everybody's here today. The request for the criminal background check form has been upgraded to use electronic signatures. The instructions are noted at the top of the form when you go to the link. The link is still an accurate and current link. You will put the applicant will fill it out and put the facility email as well as the applicant's email. Once they hit submit at the bottom, it's going to send that consent form to the applicant, where the applicant will electronically sign it by using their finger, or they can actually type their name in. And once they hit submit, that's going to send that electronic form to the provider with your signature as well as the applicant. From there, the provider will save that document. The third page is going to be a certificate page. So just make sure to email, save that to your computer, and then you will upload that 3-page to the NICAR system like you did prior. I will put my contact information in the chat box, and if any provider has any questions, feel free to reach out to me, and you'll have a good day.
Thanks, Brenda, and we appreciate all that hard work that you're doing over there in the background check unit. I know that that process has gotten just so much easier now that we don't have to have everything all notarized and those signatures
Right.
done.
And
So
that saves time for you printing it, having to get notarized because the notary section is no longer there. So you don't have to do that step. So it saves a little bit of time for you.
all right. Well, thank you so much. Well, on that note, we are going to hand it on over to our next guest speaker that we've got today. We've got Amy Webb, who's joining us, who's going to give us some updates. Amy, go ahead and take it away.
Hey, good morning, or is it afternoon? I haven't kept up yet. Thanks for having me again. I really do appreciate it. For those of you who may remember, I joined this call a few months ago to talk about the public health emergency and the impact on Medicaid. So I wanted to come back and give you an update and also make a specific ask of all of you. So at the end of 2022, Congress passed a law that required states to start undoing all the temporary changes they had put in place during the public health emergency. And we had to start doing that April 1st. And one of the biggest things that we had to do was redetermine eligibility for Medicaid clients, because during the public health emergency, we did not remove people from the Medicaid rolls except for very limited circumstances like death, moved out of state, incarcerated. And we called that the continuous enrollment condition. So now we've started that process. We've been sending out renewals for a few months to the clients that are most at risk of losing coverage. And a lot of those are children in the Our Kids programs. And DHS has worked really hard to try to reach these families. We've sent letters and texts and emails and electronic alerts. We've been sending lists to primary care physicians. We did some grants for community-based organizations. But what we know and what research shows is that people are going to listen to people they trust and know. And they trust and know y'all. You take care of their children every day. And so they're going to listen to you all if you say, hey, did you know DHS was doing renewals? Have you gotten yours? Have you sent it back in? And there's particular concerns because there have been a high number, not just in Arkansas, but across the country, of procedural terminations. So those are people who have not returned their renewal packet, or they did not return information we requested. And the federal government has concerns about that. We have concerns about that. What we hope it is that people don't need it anymore. So they're just not turning it back in. But we know that there are people who potentially are at risk, who are eligible. And so we need your help. And so what I'm asking today is for you all to share some messaging with your families that you serve. And we have two, and I'm going to put it in the chat. There are two websites you can go. The first is ar.gov/renew, and there you'll find messaging where it talks about, hey, renewals are coming up, so please send it in when you get yours. And it's just real simple messaging. It has phone numbers people can use if they need help. And then the second one, oh, and let me back up and say, there are on those websites, there is information in English, Spanish, and Marshallese. And we've created social media graphics that you could use, draft emails that you could use, draft text that you could use, flyers that you could put up in your facilities or hand out to families. So all of that is already there and already available to you. So you don't have to draft it yourself. It's already done. And then the second website, let me put it in the chat as well. And then I'll tell you, it's called ar.gov/cover. And really what it is it is designed for those people, for whatever reason, they did not respond to their renewal. In Arkansas, there are opportunities for people to come back in, provide what we requested, and get their coverage back open without having to reapply. So, and depending on what category of assistance it is, it's either 30 days or 90 days. So we want those people to know, hey, you can come back if you need to. And so ar.gov/cover has information about what to do if they lost coverage. It tells them how they can appeal. It tells them how to get their coverage back. But it also lets them know that the marketplace is available if they make too much to be eligible for Medicaid, but only just slightly more. There's a lot of federal subsidies on the marketplace to help cover premiums for insurance. So we really want people to stay covered. We know that that's important. That's how they get their preventive care. That's how they get their vaccines, particularly for kids. And we're just hoping you guys can help us get the message out. And if there's something specific you want that you don't see, if you'll reach out to me, and I'll put my email in the chat, we'll be happy to develop it for you. And that's all I've got. And I'm happy to take questions if you have any.
Thanks, Amy. We appreciate you and all the work that you all are doing to try to keep families covered and their children covered. Please, if you have any questions, you can drop them in the chat box. Amy has added the information. She's also put her email address. So if you have any specific questions, please feel free to reach out to her. I am going to introduce our next speaker, Mindy Shaw. Mindy, I've known for several years, and she's in a new role for me, but she is the pre-K director coordinator at the Batesville School District. So Mindy is our provider today that's going to be talking about some of the things that she's done with COVID relief money and American Rescue Plan Act funding. So Mindy, I'm going to toss it to you.
Hello, glad to see everybody today. I've been a director here since July. And so some of the things that we've been doing is with our money, working on our curriculum and our classrooms, trying to make sure that we are getting everything ITERs and ECHRs ready. And so that's how we've been using a lot of our money. And one of the things that we did was we implemented the Mud Degrees program. I don't know if has anybody else joined the Mud Degrees program. And we purchased all these little dogs for all of our kids in our classrooms for all of our 3 and 4-year-olds. And so this is a great, if you're not familiar with the Mud Degrees program, it's a social emotional program that helps the children be able to learn how to interact, how to be kind, how to care for others, how to be interactive with others in the classroom in a calm, caring way. And we do all this by teaching the children how to care for their dogs and therefore how to care and interact with the others. And so it's a great little way. You can get these little dogs on Amazon and they're washable. And so we can reuse them over and over and over. And one of the things we did was we bought the same dogs for every child in our facility. And so that way they're no different than anyone else's. So if someone picks another dog up, there's not, that one's mine. And so that makes it very easy for sharing and being interactive. And then as they get a little grubby, you can just wash them, throw them in the washing machine and wash them, and they turned out really, really well. We're also working on making sure, as I said a while ago, that materials are used correctly in the classrooms, making sure we're following all the ITERs and ECHRs policies and procedures, trying to increase our curriculum, trying to make sure we're leveling up. I know some of y'all are all probably doing the same things. We also have worked really, really hard on licensing this year. That has been my main focus. And I'm proud to say that we have not had one write-up all year. And when I came to this facility, we could not say that when I first started. And since I've been here, we have done that. That is a major accomplishment, and that is due to all of my teachers working together and trying to make our facility the best we can, because we all know what we need to work on and what we need to work forward with. And so keeping the children safe, keep helping our children our teachers know the rules in the classrooms, the ratios we have taken. We have the ratio poster that has the ABC ratios and also has the licensing ratios. And we have one of those in blue in every classroom in the building. So you can always look at that if you're unsure how the ratios may change throughout the day as teachers are coming and going, and lunch and breaking with them. And so that has been a great way, because teachers can look, and if I don't have X amount of kids, then I can't go anywhere. So I need to pick up that telephone. I need to call the office and say, I need help. We also installed telephones in each of our classrooms. That has been a huge, huge help. When I first came here back in July, we did not have telephones, and we have 20 classrooms. We're in an old elementary building, and we have 3 buildings of kids. And it was very hard to keep up with everyone without a phone. And so we had an old intercom system that did not work all the time. And so we spent the money to put phones in. And so the teachers can now, if they don't get enough lunch trays, or you have a child come in just a few minutes after breakfast is finished, but they're hungry, then we can call the lunchroom and say, hey, can you bring down a tray for so-and-so child? That has been fabulous. We've also, with our COVID money, we have changed our computer system that we use. We were using Sandbox, and we made a change back in April and switched over to Brightwheel. And so Brightwheel just provided a few extra pluses that worked for us really, really well for our program. And it's been really, really good. It was a changeover with the parents, getting the parents used to using a new system after they've been using Sandbox for so many years. But those are a couple of things we've done. We also have monthly meetings with our teachers, making sure that, and also do some weekly meetings with my teachers, working on curriculum, working on behavior, working on discipline. We've also worked with Arkansas Early Childhood. I'll let somebody rename that. It's ASU Early Childhood Services, and we worked their behavior program. And we had a behavioral person go into our classrooms about a few times a month. And then we did Zoom calls with her, and she was on hand with us to help us with our behavior. And we set up goals for language and literacy, for interactions, for social emotional, greetings at the beginning of the day, and also departures at the end of the day, nap time. And so that was really great for a lot of our teachers who were newer. Our teachers who had been here for a while knew a lot of the information, but it was a refresher for them to be able to hear that information again, putting picture schedules on the walls in those classrooms that needed those. And so those are a few of the ways we have worked through this school year. And now we're into our summer programming. We have school age kids on our campus, and so we have a school age program. And so we have what we call Camp Pioneer this summer for kindergarten through 5th grade, along with our infants all the way through our 4-year-olds and our graduating 5-year-olds that will be going to kindergarten. Some of them are still here this summer too. So we have a campus full of kiddos that we have been working with. And this is our second day. And so I got on the call a couple minutes late because we've been helping parents with check in and check out and rules and procedures that are different here compared to the elementaries, and they don't understand that. They want to be able to bring backpacks and bags and different things, and we don't allow that here. And we check stuff, and even if they bring their lunches in, which that was something we had to work on yesterday and today, explaining why we have certain rules and protocols in place. And so that's a little bit about what we've done this year. Tanya, is there anything else that you need me to speak about, or they tell me about 5 to 6 minutes?
That's great, Mindy.
Okay.
I think if you all have questions for Mindy, congratulations on your successful first year.
Thank you.
And look forward to continued working for you. But if you all have questions for Mindy, she has an incredible background, and just would offer her up as an incredible resource, working in a school district now, but formerly in higher ed. So great to hear
26
everything.
years
that
in
you're doing.
higher ed, and then
Yeah.
made a career change in the last year. I'm like, what did I do? What did I do? No,
I wasn't going to say how many or how many I thought it might be, but anyway, it's been a few years. I know we've known each other for quite a while. So thank you guys. I apologize. I too was a little bit late. I was actually on a call. If there's anybody on this call from the community of Ozark or surrounding, the Butterball plant in Ozark is interested in getting into early care and education for their staff. And you are going to see more and more and more of that. And I would just say, don't limit yourself. I told them to call the school. They were like, well, we hadn't thought about calling the school. We did reach out to private childcare. I think everybody in communities needs to be thinking about how they can support children and families in the community. You know, I think schools and other individuals are a great resource too, but I just want to make sure that all of you know, this is something we're going to see more and more of as we go forward. Businesses wanting to help support their staff, to retain them, to keep them at work, to keep their children so that they're able to do their jobs and not be interrupted during the day and having to run back and forth, or just not be able to work at all. So it was a real exciting call. I did have to tell the young lady, we need to schedule a call because I've got to get on this provider call. So Becky, if you'll put up the first slide, I just want to go back to hot weather, because I lay in bed at night when I get home from Little Rock to Russellville. That drives long, and I think about a lot of things, but hot weather is just at the top of it right now. School is out, things have changed. You've got more kids, you got school age kids coming in, probably going to be a lot of field trips potentially. Please, please, please pay attention to what's going on if you're transporting kids. I'm going to stress it probably on every call until we get to November or December, when it starts cooling off in the state, if it ever cools off again. But I cannot stress enough, none of us want to see anything happen to any child. And it is really hot for the first part of June. It is already really, really hot out there. So just wanted to emphasize that. I think you've heard from all the other folks. So I've got a couple of things that I want to cover. Probably some of you, and I know I've received a couple of phone calls, maybe some of you didn't notice it, but we have had some federal draw issue with our child care development block grant. And so if you were billing, you may have noticed there was a little gap in when you were reimbursed. So just know that has been resolved. Everything is back on track, but it did last week or the week before. We had a couple of days when providers had billed and they didn't get reimbursed. It was hitting against the system. Our finance folks have worked on that. It's nothing that we can do in the Division of Child Care. It is strictly on the finance side, but we did work with our finance team and the folks who do the federal draws to get all that back on track. So, but if you see a problem like that, please let us know. If you bill and you normally get your payment in a day or two and you're not seeing it in your account, please don't assume that we know here. We may not know until we hear from you that there's a problem. So don't hesitate to reach out and let us know, but it is back on track. I just would remind you that we are going into the last month of the state fiscal year. So if you do childcare billing, there is a shutdown point, usually at the end of June. Laura is at a conference in Dallas, so I don't have that, but we can post it on the website. Like, if anybody knows on the call what those dates are, Paige may know, but what that close down date is, It's usually right at the end of June, and then everything comes back up usually around, the 4th of July, the first day after 4th of July. So there may be an intermittent period there. You can bill, but you won't get paid during that closure time. It happens every year. It's not anything new. I just always want to remind you, don't, just be aware and get your billing in for all the days that you can up till that time frame. So we'll post it so that you'll know, and we'll put it on the billing website. We usually put it out there for you to know that, but we will put it out there so you will be aware that there is a time when not DHS, but the ACES payment system for the entire state of Arkansas shuts down. So just be aware that we will post it so that you'll know, but it's really several weeks away. Just want to make sure that you're prepared for that. So if you've got payroll and things, get your billing in for up to that point. Don't wait until the last day of June to bill for kids back at the 1st of June. I know most of you don't do that, but we do have some providers who do that. So just want to make sure you're aware, because I don't want you calling crying whenever you don't get paid. I can't help that if you didn't bill. If you do see a problem though, please let us know. The other thing I want to talk about, my topics aren't fun today, guys. I apologize. That's why we had Mindy. She's talking about all the good stuff. I have seen a rash, and I'm actually getting ready to get a report run, but a rash of maltreatment investigations in childcare centers. We routinely get those. And those of you who have been involved in it know it's never fun. Sometimes it's a staffing issue and you all take care of it and get it resolved. Sometimes it's just, a rogue staff who does something wrong, and we have to resolve that through personnel. But I'm seeing a lot, and they're not normal. And I had one yesterday, a 12-month-old with a broken arm, like a lot of really serious injury type stuff. And on the other side of that, I'm seeing lawsuits against facilities because of these types of things. So I don't usually see a lot of those. Like, I've been here 20 years and I've probably only seen a handful over the years, but I've seen 2 lawsuits in the past month. I just want to, and I know we probably have a lot of young and new staff out there working. We're kind of recovering from the pandemic. I cannot stress enough about risk mitigation in your program. Please impress upon your staff that when they're taking care of babies and young children, it is all hands on deck all the time. They cannot take their eyes off. Things happen, accidents happen, but some of the things that I'm seeing, like a baby whose bottom was so raw from a diaper that the skin was coming off, according to the pediatrician. So I'm just telling you real life things that I'm seeing daily. That is just purely neglect. That is just purely someone not changing a diaper when they need to, gang. And that's unacceptable. That's just unacceptable. So I just wanted to raise your awareness of it. Make sure that if you're a director, coordinator, you're getting into the classrooms and checking on your team. Maybe they're stressed. We've all been through a lot of mental health and struggling type of issues, but we've got to do well by our children. They are trusting and depending on us to take good care of them, and that is our job, and we must do that. I implore you to just pay attention to what's going on. Hopefully it's just a little bump, and it's not something that we're going to see over and over, but I'm very concerned about the number, and it does feel like there's a lot. So I'm going to be doing some reporting and maybe have a report for you at our next call, just so you can kind of see what I'm talking about and the kinds of maltreatments. A lot of times a maltreatment does not get founded, and many of you know that. It doesn't get founded. We get lots of calls, but it's unfounded. About 2/3 are unfounded normally. I'm not sure we're in that right now. I feel like there are a lot more getting founded, and that's very concerning. And I just wanted to raise your awareness. I know everyone on this call, because you wouldn't take time to do it, is probably paying attention, but please remind your colleagues who aren't on the call. Please let folks know we have to do well by our babies. The parents are trusting us to do it. The babies are trusting us to do it, and it just is our job to do that. So doesn't cost anything to be kind and to try to raise that attention and awareness to detail that we need. So I hate to be the messenger on that, but I just wanted to make sure you're aware of it as we are seeing so many come through, and I do have concerns about that. So I'm going to stop there. I do want to let you guys know, we had planned to be talking about LEARNS, but if you're paying attention to the news, we have a lawsuit, and so we're in a pause. That's what we're calling it, a pause, until that gets resolved. And so at whatever point that's resolved, we will resume our conversation about the LEARNS Act and any changes or direction that we can update you on. So I apologize. I had hoped we would start that this month, but we are in a pause right now. Lastly, we are not going to have our next call was scheduled on July 4th, and I'm not sure any of you want to take off or be on a call on July 4th. I hope all of you are going to be with your families doing something fun. But we are going to cancel July's call. If there's something emergency, we'll post it on the website or we'll put it on the billing website, but we will cancel for July. That way folks can have a break, vacations, enjoy the 4th of July. And then we'll come back on August 1st. Becky's got the first Tuesday and it's August 1st for our next call. And hopefully we'll have some updates about LEARNS and other things, and some other additional providers to talk about what they've been doing. So I'll stop there. I don't know if anybody has questions in the chat box. I've been trying to monitor that as we've been going. Kelly, thank you. Kelly has the billing system lockout June 24th through July 4th. That sounds about right. That's typically when it does go down. So just be aware for billing, any child that you've kept up through June 24th, you can bill for. And you can continue billing between June 24th and July 4th. There just won't be payment until after the system comes back up on July 5th. So just wanted to make sure you're aware of that, especially if you're a newer provider to the child care billing system. That is an annual event that happens here because the ACES system does shut down, and it gives the state and the folks over in the big finance world an opportunity to reset everything. So, and Mindy, really glad to see Medigrees. I put that in the chat, but glad to see Medigrees curriculum still being used out there. It is a great program for those of you who are not familiar, and it's been around now for probably 20 years or more, maybe 25. But it is a great way to teach a lot of really incredible social emotional development skills to young children. So, all right, with that, I see a message. I'm monitoring. I'm not going to let you guys go if there's a question. Okay, so I will talk a little bit just for everyone to be aware, and this is not new. I think we started in April, maybe March, probably April after the tornado. We do have funding for those communities that were hit by the tornado at the end of March. We announced that, I believe, on the April call. So that's Pulaski, Lone Oak, and Wynne, or Cross County. Sorry, I can remember that county for just a moment, but Cross County. Those 3 communities. It is also available for child care employees, early childhood. So for any of your staff, because we do not have the same amount of money that we had at the beginning, we are down to the very last little bit. And we can only serve, a handful of families. I believe it's about 1,700 to 1,800 total, maybe even less than that. And so if you have staff who work in early care and education that are eligible, that would be eligible and are working this summer, please have them submit an application to offset if they're paying for childcare. We want to honor our field with this remaining money, and we wanted to capture those families for any of the essential work areas that were impacted by the tornado. So if that doesn't make sense, it's those families impacted by the tornado in Pulaski, Lone Oak, and Cross County, and then statewide for early care and education employees across the state. And there is no new money. It is the remaining money that we are reconciling that has to be out the door by next September 30th. So they may get up to a year of childcare. It might be less than that, but they might get up to 12 months. But it will end. That funding will end September 30th. We don't have any way to carry that forward. So that's why you're probably getting communication about that. So I don't know if that's been clear to everyone. the child care, early care and education is statewide. It's not just for those impacted counties. It's for workers across the state. With that said, we might give you guys a little more time back today than normal. It's a little bit shorter call. I thank you guys for everything that you're doing. Always take care of those babies through August, and we'll see you on the August call. The tornado relief, if you're in Pulaski, Lone Oak, and Cross County, they just submit an essential worker app. I don't know if somebody can drop that into the chat box on the family support team. If not, we can post it on the website. I believe it's already out there, but we can make sure. Debbie, if you want to send, yes, hang on. It looks like lots of people are needing that. So let me go find that email address and get that. Okay. Teresa Cooper, thank you. You can apply using the regular low income application. So that is on the website. So regular low income application will get you essential worker childcare. Thanks, Teresa. I appreciate you putting that out there. And there, Naven has put it in the chat box. So for those of you who have employees, and for those of you in Lone Oak County, Pulaski County, and Cross County, who have families that are essential workers. And it's the same buckets that we had before. So it is, we already have early care and education covered. That's no matter where you are, but it would be your individuals who work in food, and that is from the farm to Kroger to McDonald's, any kind of food industry, medical and health industry, state or federal government employees. So it's the whole range of essential workers that we had before. In Lone Oak, Cross. Yeah, I'm going to drop those in the chat box so everybody can see them. So it has to be, and there were only 3 counties that were designated, but Lone Oak, Cross, and Pulaski are the 3 counties that are impacted by the tornado. So there they are. For all counties, it is child care and early childhood workers. That's who can apply for the essential. So they may be income eligible. And if they are income eligible, we'll put them on regular low income childcare. But if they're above the income, then they would be eligible for essential. That is across the state for early care and education. But for all the other categories of essential, it's Lone Oak, Cross, and Pulaski. I hope I've just confused everyone completely with all that information. Hopefully that's more clear. Childcare, early childhood across the state. And for Lone Oak, Pulaski, Cross County, it is for all essential workers. So it's education, early care and education. So staff who are in classrooms, staff who are working in a licensed childcare, early childhood education type program. It could be an early intervention program, guys, if that's what you're thinking for medical, but it's not health or medical unless you're in one of those 3 counties. Thank you, Sarah Norwood, who used to work here and still is really good at dropping things in the chat box for our division. I appreciate you. All right, gang, listen, have a great rest of June and July, and we will see you in August. You know how to reach us if you need something. Again, we appreciate you, and we'll see you in August. Thanks.